Hello friends, in the series of clinical tips towards classical homeopathy, today I am going to tell you about the significance of the fingers, the emotional conflict regarding all the four fingers and the thumb. Why? Because today three cases of trigger finger came and it is very important how to enter the case, what is the exact conflict we should look upon in order to find out the emotional cause. So, our thumb represents our ego, our confidence, and the logic and the willpower. Thumb also represents our independent thoughts. So any skin lesion on the thumb or any kind of injury on the thumb, there has to be some problem with the logic and the willpower. Our independent thoughts were disturbed because of some reason. So we need to probe about that. Then comes the index finger. Index finger, it represents leadership, it represents ambition, it represents self-confidence, it also represents authority. So any problem with authority and leadership affects this finger. So when there is a trigger finger and in this condition, the tendons become rigid, and when you force upon them, suddenly it snaps open. So here the person is quite rigid about his authority. His authority was questioned. That is why gradually the tendon went into rigidity. Then comes the middle finger. Middle finger is in the middle, so it is responsible for balance as well as for personal identity. If the personal identity of a person is losing away and he doesn't want to lose his personal identity, then this middle finger becomes rigid, the tendon becomes hard, and any pathology, even like on the skin, eczema or dermatitis or anything, if it is there, it signifies that the personal identity is getting disturbed. Then the ring finger. This ring finger represents love, relationship and attention. If a person is having problem in this area and he wants excessive love and attention, so the tendon becomes rigid and he can have trigger finger on this finger. Little finger, it gets affected when there is relationship issues in personal life as well as in business life. So this is how you probe the various pathologies which occurs in the hand. Any fractures or any skin lesion, you try to probe in this direction. This another case which I treated was an old patient came with right-sided gynecomastia. So, not right-sided, sorry, left-sided gynecomastia. He came with left-sided gynecomastia. It was very painful. And at this age, what could be the reason for a person having this gynecomastia? So we need to probe. Interesting thing was that this person was left-handed. So any conflict relating to business or money or finance or partner are related to this side. So I asked him, sir, what is the issue with your partner or any issue with finance or any issue in relation to your business life? So he said, ki, sir, recently I resigned from my job. Actually, my age is around 70, so I had to uh, call off from the job. And after this, gradually, this swelling started happening. Why? What happened? Because you are at an age, so naturally you have to retire. But sir, I do not want to leave the work. I want to work. So this point was very important. This person was very fond of work, and he wanted to work and he wanted to continue his job. But because of some reason, he had to. Some reason means age factor, or he was getting old. So they told him that now you need to retire. So now what is the rubric? So very important and very beautiful rubric was selected. Activity desires, activity business. So at this stage only also he wanted to work, he wanted to engage in some kind of business or some kind of work. So the rubric taken was activity desires, activity business in, and bromium was prescribed single dose. Until date, almost 50 to 60% of swelling is gone and pain is also very less. Another important point here is, if you look at the bromium in periodic table, you will find the very beautiful theme of bromium written in that bromium patient has a theme which is related to let go of. Let go of work or let go of power. So when these things are let go of, then naturally there is disappointment, there is sadness, and there is pain in the heart, which this patient experienced. So here bromium worked very nicely. So the rubric activity desires, activity business in. Very small rubric, but it cracked the case. Another case of renal failure came with creatinine around 3. I asked him, sir, what is the stress factor in your life? So he said, sir, there is no stress, not much stress factor in my life. I am worried about this swelling in my feet. I said, sir, this is because of the kidney failure, and kidney naturally spontaneously will not fail. Some reason has to be there. Either there must have been some stress factor, or you must have felt stressed out in your life, and gradually this condition happened. Sir, there is nothing like that. I am happy altogether. So I thought, why is he reacting? I again tried to explain the importance of stress and disease. So again he reacted in the same way. So here an important organ, that is kidney, is failing, and this person is not at all concerned about. He was just saying casually, as if, okay sir, there is some problem in the kidney, like that. So he was talking very superficially, very lightly. So his attention was in the wrong direction. I asked him, oh, what is this stress? He said, sir, I am having this pain in my body. And I said, why? What? So this patient was talking very superficially. So I gave him Baraita 200. These Baraitas, they are very superficial and they have no depth and they have no understanding, no matter how hard you try to make them understand, but they won't. So different Baraitas have, you can differentiate very easily. So Baraita mode is like silent Baraita, very reserved. Baraita self is talkative Baraita, but is very social, but he can do quite a lot of literary activities. Then this Baryta floor. Baryta floor is fast and buoyant Baryta. So buoyancy means he is able to tolerate stress and he is able to manage himself very well during stress. So this is Baryta floor. And yes, this is all about the few tips which I was able to give to you. I hope it helps you in your practice. Please like, comment and share, and please post any queries if you have. I would love to answer all your queries. And I'm sorry that the voice is reverberating a lot today, but kindly bear. Thank you.